what we're intending to do and what we don't want people to conclude from what we're doing here. The Army Corps of Engineers has been in contact with um, us here locally, and if, as you may have seen in several other communities, what they have done is they have gone in and, in essence, constructed alternative care facilities, not hospitals per se, but hospital-like facilities. And then they've turned them, in essence, over to the state or local governments to work with the hospital systems to provide what I would describe here as a phase 5 in terms of expansion of bed capacity in the event that we need it. And that to me is the key phrase, in the event that we need it. I think every single one of us on this call are hopeful that we have current capacity in our hospital system so that when the surge comes, that we will have an adequate number of beds, that we'll have an adequate number of ICU beds, and we'll have an adequate number of ventilators. There's also the issue of personnel and PPE, the personal protection equipment, which is a different issue. Those are different issues, but obviously very, very important to what we're talking about. So oftentimes I think people are critical of government because they're saying that they're not preparing. This is an attempt to prepare in the event that we need this. Now, when I say when we need this, we are talking 10 days to maybe 21 days, and Dr. Weston can correct me. He has been critical in providing the modeling for what we're doing here. He bases it in part on the modeling that comes out of Washington and in part of the modeling that we are developing here. But my hope is that if we decide to go forward with this, and I'll talk about that in a minute, if we decide to go forward with this, that this will be an exercise that we never have to utilize. In other words, that we don't have to draw on these beds, but the goal is to be prepared. We would rather start the ball rolling, and that's what we're doing now is we're starting the ball rolling by requesting the state to request the Army Corps of Engineers to move forward to construct this alternative care facility. Again, at the end of the day or at the end of the week or at the end of the month, I hope we don't use it, but that's what we're doing now. If we didn't move at this speed and we decided 2 weeks or a week or 10 days from now to do it, we may not have enough time. And the reason we may not have a time is we may not have enough time just simply because the time had passed. But the other reason is that there is incredible demand, I believe, on the Army Corps of Engineers in constructing these alternative care facilities. So it's important for us to put our marker down. And so that's what our intent is now, is to, with the state of Wisconsin, and the state's been incredibly receptive to all of this, is to put our marker down for a facility that would allow us to have beds if we need them. That, of course, is not the end of the story, because along with the actual beds themselves, we will need to know whether our hospital systems, other healthcare providers have both the personnel and the personal protection equipment necessary to run these facilities. And that's part of the analysis that's going on in real time today, whether they can do it, whether they'll be able to, if we get these beds in place, and if we need these beds, whether we will be able to actually run them. So that's a secondary concern, but it is an incredibly important concern. So the point today is to talk a little bit, and we've got others here who can talk about more about the particulars. But that's sort of the overview, that what we're doing right now is a step that we are taking, a necessary step in case we need these beds. People should not be overly concerned because, again, I'm hoping that 2 weeks, 3 weeks, 4 weeks from now, people will say, well, they spent that money, but they never needed the beds. I'd be the happiest guy in the city if we spend the money and we don't need the beds at the end of the day. But the modeling that has been done has led us, at least at the government level, to conclude that this is a prudent step to take, to ask to have the Army Corps of Engineers actually start to do this construction. So with that, I'm going to turn over to Dr. Weston again, who's done a great job in getting us to where we are right now. Dr. Weston.
Thank you, Mr. Mayor.
Actually, if I could jump in, I'm sorry, Ben. We skipped over County Executive Abele at the jump. So, County Executive, did you have anything you wanted to add before we?
Yeah, sure. No, I just thanks to the mayor for the summary. I mean, I just emphasize again, First, the collaboration, and people should know that there's an awful lot of great public servants working extremely hard, extremely long hours, doing everything they can, trying to save lives. Second, the point that the mayor made also again about, look, this isn't about an abundance of caution. That is our job. We always have to make assumptions to be prepared for a worst case scenario and hope and work diligently to avoid it. Again, the mayor will be the happiest guy in the city. I'll be the happiest guy in the county if we get a build out and a building that we don't have to use. But we're going to be darn sure that we're ready. And I think the common belief among everybody involved here is we owe the people we all serve no less than to be ready to shoot for the absolute best outcome, but to be ready for the worst. But again, that's why we say every day, and you'll hear us say it again, the best way to avoid a scenario where we're using that building is to stay home and save lives. It's to isolate and avoid social contact. It's hygiene. It's the social distancing. Everything you've heard us say, that is the way we avoid it. But again, it has been phenomenal to work with a lot of great leaders, and the coordination has been fantastic. Dr. Weston?
Thank you.
Thank you. So we did yet again see an increase in the number of confirmed cases of COVID-19 in Milwaukee County to 918, as well as an increase in the number of individuals who have died to 18. As we work closely with our health departments, the Office of Emergency Management data team, and our academic partners to gain a better understanding of the effects of COVID-19, there are no doubt parts of our community that are currently more affected than others. And while the overall rates of confirmed cases as compared to our population is around 100 confirmed cases per 100,000 of populations, there are portions of our county that lie much closer to 250 confirmed cases per 100,000. The reason I mention this is because that number is concerning. It's concerning because that number is similar to where cities such as New York were less than a week ago. So with these numbers in mind and concerns for a possible surge in patients, as we have seen in other communities around the country and around the world, we have been working with our leaders of our health systems to ensure that we have a detailed understanding of our hospital bed and hospital resource capacity and availability for individual health systems to increase that capacity in an informed, efficient, and responsive manner. Through these efforts, the healthcare systems are working closer than ever before on data, resource, and knowledge sharing to better serve our community. Combining this information on hospital capacity tracking with projections on how COVID-19 may affect our community, we can better predict the needs that will be to come and that may come. So as we've seen in other cities and countries, when COVID-19 spread and illness reaches a certain point, even the largest and most efficient hospital systems at times may require further support outside of their four walls. And for this reason, with the leadership of County Executive, of Mayor Barrett, of Mayor Devine of West Allis, and all the mayors, the state fair officials, our health systems, and our health departments, we are moving forward in obtaining available resources to create a facility that, in the situation in which we would need increased space and increased medical capacity, we would be able to provide care for our citizens in need. The State Fairgrounds provide an optimal location for this space, considering the ease of access, abundant parking, central location to a variety of resources. We certainly hope, as the mayor and the county executive said, that we will not reach the point where we will need to use this location. But more than that, we want to avoid a situation where we decide we need this facility too late, when we already have patients in need. So our city, our county, and our municipalities are working proactively, and I think wisely, to plan for the care of all of our citizens, wherever they may come, or and whenever they may come. So help us avoid using these facilities, help us avoid overwhelming our hospital capacity, help us continue to serve you by staying home. Thank you, and be safe.
Brian?
I think you're muted.
Sorry about that. It took me a minute to get back to my screen. Thanks, Dr. Weston. Next, we're going to hear from Mayor Dan Devine from West Allis.
Good afternoon. As I've said earlier, this is something that I figured we would be having this conversation at some point. And I want to echo what Dr. Weston said. This is really about being proactive, and it's also about being taking a regional approach. This should have, we're going to do everything we can to make sure this has a minimal impact on the surrounding neighborhoods. And this is going to be a very smooth operation. Like Mayor Barrett said, we hope we never need it. It gets thrown around a lot, but I'm going to use it again, and we're going to plan for the worst, but hope for the best. And I just want to reiterate again that we are echoing the Safer at Home message in West Allis continuously, and our community is looking forward to being a partner in this effort.
Thanks, Mayor. And we also have with us John Yingling, who is the chair of the State Fair Park Board of Directors, I believe. Did I get that correct, John?
You did.
Thanks. And what would you like to share with us today?
Well, again, we appreciate everybody. We've been working with County Executive Abley and his staff, Mayor Barrett, his staff, Mayor Devine. We appreciate the guidance of Dr. Weston, the Army Corps of Engineers, as we continue to work with state and federal officials on determining for Wisconsin and for metropolitan Milwaukee if State Fair Park facilities could meet the need of an alternative care facility. Now that has been decided, we at State Fair Park are ready to serve if needed. And as everybody had indicated, we hope it is not needed, but State Fair Park Board and staff are prepared to do our part to assist. We have the facilities, we are ready, and we are looking to make sure that we are operational as quickly as possible to provide services we hope are never needed.